Welcome back to Health Bulletin. Today, we're connecting the dots between two deadly diseases making headlines, measles and tuberculosis. In our interconnected world, where health security anywhere depends on action everywhere, let's break it down for you all. Start with measles. As of March 20th, 2025, the CDC has confirmed 378 measles cases across at least 18 jurisdictions, from Alaska all the way to Texas. And here's the thing, measles, a highly contagious respiratory illness, can linger in the air for up to 2 hours after an infected person leaves the room. With symptoms like high fever, runny nose, and that characteristic rash, it's a disease that can spread like wildfire if vaccination rates drop. In Europe, we're also seeing a resurgence, and even in the US, major outbreaks are raising concerns. It's a stark reminder that, despite being declared eliminated in 2000 thanks to robust vaccination programs, measles can make a comeback when we let our guard down. Now, shifting our focus to another global challenge, tuberculosis. With World TB Day today, the World Health Organization is sounding the alarm. TB remains the deadliest infectious disease, claiming over 1 million lives every year. Even though global health initiatives have saved an estimated 79 million lives since 2000, but recent cuts in global funding are putting these hard-won gains at risk. Countries, especially in the African, Southeast Asian, and Western Pacific regions, are struggling with shortages in human resources, disrupted diagnostic services, and fragile data systems, all worsened by funding freezes and shifting political priorities. And here's something else that's concerning. These funding cuts aren't just affecting TB programs. For example, in the Democratic Republic of Congo, US funding freezes have impacted the transport of crucial laboratory diagnostics for mpox testing. And there are warnings that 8 countries might soon run out of life-saving HIV medications. It's a domino effect that really makes you think, if we don't shore up global public health now, who knows what might happen next? Meanwhile, there's promising news from China. On World Tuberculosis Day, Chinese researchers launched clinical trials for a novel mRNA vaccine for TB at Beijing Chest Hospital. According to a 2024 WHO report, more than 10 million new TB cases were reported worldwide last year, with China accounting for about 741,000 of those. This innovative vaccine could be a game-changer in TB prevention and control, especially given the heavy burden the country faces. But the challenge is far from over. Over in India, the fight against TB continues with the ambitious TB Free India campaign, launched back in 2018. Despite making notable progress in reducing cases and improving access to treatment, India has already recorded over 500,000 TB cases this year. Considering that India still accounts for more than a quarter of the world's TB cases, it's clear that sustained efforts and stronger interventions are absolutely critical to meet the WHO's elimination goal by 2025. So, what does this all mean for us? From measles making a comeback in regions that once had it under control, to the ongoing struggle against TB and the ripple effects of funding cuts across the globe, it's clear that our fight against infectious diseases is far from over. Our health security depends on local action and global cooperation, and staying informed is the first step to making a real difference. We have the tools and the knowledge to shape a safer future, but we must stay vigilant and proactive. If you found this video informative and essential, be sure to like, share, and subscribe to Health Bulletin for more updates on outbreaks, scientific breakthroughs, and everything that shapes our future.